And this workshop tonight is intended to assist potential applicants in getting through the application process. So I'm going to be focusing a lot on the actual application itself and providing some of those details. It's kind of more of a nitty-gritty workshop. I'm going to be talking about the program, a little bit of background about the Community Mitigation Grant programs. For those of you who are familiar with the program, maybe you've received funds in the past or you've applied in the past, there have been some changes, so we'll talk about what's new for this round. Talk about how to apply, how to put together a competitive proposal. I'll provide you with some information about where you can go to get more information, and then we'll have time for some Q&A at the end. One other thing, we do have the actual request for proposals, the RFP is up on the website. I'm not going to go point by point through the RFP tonight, and you'll hear me say this a couple of times. Read the RFP, read the guidelines. That's where you're going to get most of your information in terms of applying for this program. So just a little bit of background about the Community Mitigation Grant programs. They're designed to reduce the impacts of port-related air pollution. And one of our goals is that we want to benefit the most people possible. So we do have a metric, which is the number of beneficiaries per $10,000 of port dollars, and we'll talk about that a little bit more later. And we also want to help the most sensitive populations. These are the people who are most impacted by port-related pollution. Children, the elderly, pregnant women, and those with respiratory or cardiopulmonary ailments like asthma. There are 3 programs. There's the Schools and Youth Facilities Program, the Healthcare and Senior Facilities Program, and we also have a program to reduce greenhouse gas emissions. And this is the one that we're talking about tonight, our Healthcare and Senior Facilities Program. We have $1 million in this round of funding. So again, those of you who are familiar with the program, there have been some changes. One of the major changes is that we've added pregnant women as a target population because they are particularly impacted by port-related air pollution. And that means that if you're an organization that serves this population of pregnant women, or you have a project that you want to propose that serves pregnant women, you would be eligible to apply for this program. We also removed the time caps. So in the past, you were limited to applying to 3 years of funding for healthcare programs. That's no longer the case, but the caveat is that this is one-time funding. So you're going to be awarded a chunk of money, and you can choose to spread it out over as many years as you want, but it's one-time funding. And then the other major change is that for this round, we're funding healthcare programs only. In the past, we had an option where you could apply for facility improvements like air filters or new windows and doors for hospitals and senior care facilities. This time around, given that we only have $1 million, we're limiting it to healthcare programs only. So who's eligible? You need to meet 2 conditions. The first is that you need to serve our target population, so that's children, the elderly, pregnant women, or those with respiratory ailments. And you need to fall into one of these 3 categories. So you need to be a facility that's licensed under the California Health and Safety Code, and the RFP has the specific provisions of that code that you would need to fall into. Generally, it's things like hospitals and clinics and assisted living facilities. Or you can be a government agency or a 501c3 nonprofit. You also need to make sure that you're serving populations within our grant zones. We have 3 grant zones. They're roughly based on miles from the port. So zone 1 is about 1 mile from the port. Zone 2 is 2 miles. Zone 3 is 3 miles. And these are designed to help us prioritize the impacts on the population with the theory that those who are in zone 1 get the most impacts from port-related air pollution, so they get the highest priority. You'll also notice that there are A zones and B zones. The A zones get higher priority than the B zones because the winds are traveling east from the port, so the A zones get more of an impact. Now, we recognize that many of your organizations may not physically be located in these zones. Maybe they're headquartered somewhere else, or you have administrative offices somewhere else. That's fine. What we're looking for is that you're serving the populations within these 3 zones. We will fund healthcare programs that aim to reduce the health impacts associated with port-related air pollution. So that's pretty general. It includes things like screening and diagnosis, so you can apply for funding for spirometers or other types of equipment that would be used in a diagnostic type program. You can apply for outreach programs, which it could include a community health worker program or a mobile clinic. Or you could do an education program that teaches people how to manage their asthma symptoms or reduce triggers. One thing that is important to note is that the grant funds should be used to expand or enhance services that you're already providing. So we don't want to use the funding to supplant things that you're doing. You want to expand them either by serving more clients, adding more services, or enhance what you're doing. It should be used to complement your services. And then we also have the other projects category. So if something that you're thinking of doesn't quite fall into screening and diagnosis, outreach, or education, you can propose something else, as long as it reduces the exposure to air pollution or cuts the health impacts of air pollution. You'll need to justify the cost effectiveness to us, and it needs to be consistent with the guidelines and the RFP. If you're thinking about something in this other category, please, please, please contact us. We want to make sure that we're providing you feedback so you're heading in the right direction. This is a partial list of things that can be funded by the grant. It includes things like staffing, equipment, supplies. If you've got a community health worker program where you have staff going out into the community, you can request reimbursement for the miles that they're traveling. And it's basically any costs that are directly associated with providing the services. And the RFP lists even more costs in here. This is just a snapshot. We also allow money for administrative overhead, and this includes things like your facilities rent, utilities, indirect personnel costs for human resources and accounting. You're limited to 15% of the total project cost for your administrative overhead. And this is an important point. If you're going to request 15% for administrative overhead, you cannot also request money for those individual components like rent and utilities and the indirect personnel costs. And then if the other option is that you can request an administrative overhead that's less than 15%, which brings down your total project costs and may make things a little bit more cost effective for you, which could boost your score. Other things to know for this round of funding, you're limited to $250,000 per applicant. And that's whether you apply for a single project or multiple projects. You can apply for more. You can apply for the full $1 million if you want, but you will not be awarded more than $250,000 per applicant. We are strongly encouraging partnerships this round, particularly because there's only $1 million. And if there is a partnership situation, the way it will work is that one organization will need to apply on behalf of the other organizations. That will be the entity that technically gets the award and that we contract with, and then they will be responsible for having subcontracts with the other partnering organizations. And there's always the possibility that we may decide to award partial funding. And if that's the case, and we like your project and we want to fund it, but we want to give you less than what you've applied for, we will come to you, we will give you the proposed budget and give you an opportunity to revise your scope of work. So this is our general selection process for the grant awards. We have a Mitigation Grants Advisory Committee, and they're made up of representatives from the goods movement industry, the air regulatory agencies, and 3 community members who are appointed by the mayor. They will review all of the proposals that come in. They'll make recommendations to port staff. We in turn make recommendations to our Board of Harbor Commissioners, and the Board of Harbor Commissioners is the entity that actually awards the funds. This is a look at the time frame that we're looking at. April 30th is the deadline for the applications. Throughout the summer, we'll be reviewing and ranking the applications, and our intent is to take recommendations to the Board of Harbor Commissioners in August. And then in the fall, we'll be working with the different awardees to work out their contracts. So in terms of thinking about the projects that you could apply for, you should be thinking about projects that are starting probably January 2014, kind of moving into that next year. We have 3 documents that you should review in the application process. The first is the guidelines, and this is the overarching policy setting document that's approved by our Board of Harbor Commissioners. It talks about the goals of the program, the eligibility requirements. Then we have the RFP, which gets into a lot more of the details about what you need to apply, what you need to provide for your application. And then lastly, we have the online application, and this is really just our mechanism to collect the basic information and for you to upload your proposal narrative and supporting documentation. And we're going to walk through that online application process. All of these documents are available at www.polb.com/grants. So before you begin, read the guidelines, read the RFP, make sure that you're eligible. Ask yourself, am I serving populations in those 3 grant zones? Am I serving children, the elderly, pregnant women, or those with asthma and other respiratory ailments? And do I fall into that organization type? Am I a government agency, a 501c3, or a state health facility? And then once you've determined that you are eligible, then you can go ahead and move through the online application process. So this is the first page of the application, which is available at www.polb.com/healthgrants. There's also in the back of the RFP a printout of this entire application, because what you'll find is if you try to go online and click through it, there's a lot of required fields and you can't advance. So if you look in the back of the RFP, you'll be able to see the application in its entirety. You'll be asked to create an account, and we recommend that you do this. It's not required, but we recommend it for 2 reasons. Number 1, it allows you to log in and log out to the system, so you don't have to sit down and complete the application in one sitting. And number 2, it gives us another opportunity to capture your email address so that if something changes during the process or there are new instructions, we can log in and figure out who has started an application and make sure that we get you the right information. Section 1, very simple, collecting some basic contact information. The only thing I wanted to point out on this screen is that you'll see the little blue question mark boxes. If you click on those through the application, it will provide more information about what we're asking for. So if you don't know exactly what we're getting at with the question, you can always click on that. It'll provide more information. Section 2, we start asking you a little bit more information about the project that you're proposing. And the first thing that we'll ask you for is the project zone. Again, this is the zone of the population that you are serving, not necessarily where your organization is headquartered. And you can select multiple zones because we recognize that many of these programs may serve several of the zones. If you're not sure what the zone is, if you want a little bit more information, you can go to our website. We have a map. If you click on the map, it opens up into a new window and it becomes an interactive map. And you can actually, right up there, enter in a physical address. It'll zoom you right in. You'll be able to see what zone it's in. If you still have questions, feel free to call us. We'll provide the contact information again. It's on the little handout there, and we can help you further. Getting back to Section 2, we're going to ask you to provide your organization type, making sure that you fall into one of those eligible categories. If you're a facility licensed under the California Health and Safety Code, you'll need to provide your 9-digit facility number, which is provided by the state of California. Then we ask you to provide some information about the number of beneficiaries that your project is going to serve. And that's because one of the metrics that we use to evaluate your proposal is the number of beneficiaries per $10,000 of port dollars. So in order to come up with that amount, we need to have some information about how many beneficiaries you're proposing to serve. And we have it broken down by zone for per year and over the life of the project. We understand this is going to be a rough guess on your part about how many people in each zone you're going to be serving. So just do your best and estimate it. The reason why we ask for it per zone is because we do a weighted average of how many beneficiaries you're serving in each of those zones in order to determine that cost effectiveness metric. Another thing about beneficiaries, we're looking for the people who come into direct contact with your service, not the catchment population. So if you're a mobile clinic and you're going out to a community event where there's going to be 1,000 people there, but you're only going to have 50 people actually come in through the door of your mobile clinic, the number of beneficiaries is 50, not 1,000. It's who you're actually directly providing services to. And then we just ask you to explain how you came up with the number of beneficiaries. It doesn't need to be an extensive explanation, just, you know, there's 20 kids in a classroom, we're going to hit 10 classrooms a month, and just a very simple formula. There is a section 3. I'm not going to go into it because it's cost information. It's very straightforward and self-explanatory, because I want to spend some time on section 4, and this is really the meat of your proposal. This is your opportunity to upload your proposal narrative. And there's 6 required elements of the proposal narrative. Project description, you're going to tell us a little bit about what your project is. Under methodology, you're going to tell us how you propose to do it. You're going to give us some background about your experience. You know, you've done projects like this in the past, how you've been successful. You'll propose some performance measures, how you're going to measure your success and your outcomes. Could be things like, you know, the number of missed school days that are avoided, the number of community health worker visits that you make. Under resource capability and response, this is your opportunity to talk about the resources that you can bring to this project as an organization. That might mean matching funds, other partnerships that you'll be engaging in, and that's also the place where you can tell us how you intend to sustain this program past the life of the grant, because that's one of the things we're interested in is sustainability. You'll provide some additional details about the budget. And then for supporting documentation, we have 2 required pieces of supporting documentation. That's your organization's most recent financial audit and your profit and loss statement. And then you have the option to upload other supporting documents like resumes of key personnel, additional budget details, letters of support that you might have from other agencies. And again, the RFP has a lot more details about what to provide in each of these sections. It has a bulleted list, so please make sure that you hit on all of those elements. The last section, section 5, application review. I've reviewed everything, I'm good with it. I'm going to click submit. Once you click submit, you won't be able to go back and make changes. So which projects rank the highest? We have a detailed scoring criteria in the RFP. You can look in there and see exactly how many points you're going to get per category. About 70% of your points are coming from your proposal narrative. So that's important. You've got to write a strong proposal narrative. The other 30% are from more of these objective criteria, like the zones that you're serving and the number of beneficiaries that you're serving. Zone 1A gets the most points, and then Zone 2A and 3B. You want to stay in the A zones in order to get the most points, and you want to stay in Zone 1 to maximize those points. For number of beneficiaries, the higher the number there, the more points that you're going to get. But again, the proposal narrative is 70% of your points, so it's very important to make sure that you're spending some time there. What does a good proposal narrative look like? First, it needs to be complete. You need to make sure that you've hit on all of those points that we've asked you to hit on in the RFP. Is it clear? Is it succinct? I think there's a 5-page limit. That's what we limit it to, single space. So not a lot of opportunity to ramble on and on. You want to make sure you get to the point. Is there a clear nexus between your project and our target population and port-related air pollution? And this is really key, because when we're looking at these proposals and our committee is evaluating them, they're looking for, is this project going to make an impact for those suffering from port-related air pollution? So you may have a program that's technically eligible. Maybe you want to do a project for tobacco smokers, and maybe technically it's eligible because these folks have asthma or respiratory disorders, but you're not going to be able to draw that strong link between port-related air pollution and your program. And so that a program like that is not going to rank very highly. Can you sustain your project over the long term? We talked about that. What's your strategy for maintaining this project beyond the life of the grant? Is your project cost effective? So one of the ways to boost the points for that is to have a large number of beneficiaries. We understand that some of these programs are not about sheer numbers. You know, they're more intense services. You may only see 100 families a year, but you're providing them a very high level of effective service. So make sure to explain that in your proposal. If you've got a low number of beneficiaries, you want to really stress the effectiveness of your project. And do you have the staff and the resources and the experiences to be successful? So tell us about some of the past projects that you've worked on, that you've been successful, that are similar to what you're proposing. Please, 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 if you have any doubts, any questions, if you just want to bounce some ideas off of us, get in touch with Laura. You can contact me. We're happy to sit down with you and talk to you and provide you some feedback. And that's something that we offer any organization that wants to meet with us. We will do that. We want to make sure that we've got good proposals. We don't have a lot of money. We want to make sure we're spending our money the most effective way possible. So what I thought I would do is just highlight a couple of the programs that we funded in our first round so you can get a sense of what made them attractive to the advisory committee and our board. And on our website, we have a complete list of all of the projects that we funded so you can get more details. Breathe California of Los Angeles County in our last round received about $355,000 for their O2 4U program. This is an after-school program where kids learn how to reduce asthma triggers, how to reduce air pollution. And this program ranked very highly because it was targeting children. They had a fairly large number of beneficiaries. It was, you know, an education program, more of a mass education program. They did a very good job explaining how they've run this program in the past. Now they were expanding it into Long Beach schools, which they had not previously done. They had the expertise to make it work, and they had good partnerships in place with Boys and Girls Clubs, Long Beach Unified, and a lot of the after-school partners in the area. The Long Beach Comprehensive Health Center is a county-run clinic, and they received about $660,000 to build a cardiopulmonary lab. So the money went primarily to equipment and things like stress tests and spirometers and EKG machines. And the intent of this project was to minimize wait times. People in this area often have to go to Harbor UCLA to get stress tests, and the wait times can be up to 6 months. This project was going to whittle that wait time down to a couple of weeks. So we had very good demonstration of effectiveness for this type of program. The facility itself is located in Zone 1A, so it got a lot of points straight out of the gate for serving that 1A population. And they provided a very good explanation of how they were going to sustain this project over the long run. So we were paying for the upfront equipment and supply costs, but they had a plan in place to maintain it with county funding going forward, and that made this program very attractive. And then we have the Long Beach Alliance for Children with Asthma, which received about $490,000 for a community health worker program. And in this program, they had community health workers who would go out to the homes of families, talk to them about asthma triggers. These were families where there were children or adults suffering from asthma. And what was interesting about this program is that they didn't have a high number of beneficiaries because the services were so intense. You can only hit so many families in a year. But they did a very good job of explaining why this type of program and these services were so effective. And that was very convincing to the advisory committee and the board. They were also serving the populations closest to the port, the 1A and the 2A, and concentrating their efforts in that area. Just the logistics here, application deadline is 4 p.m. on April 30th. It's a firm deadline because it's an online application. It's actually, the link is going to go away at 4 p.m. So if I were you, I would aim for at least 3:50 p.m. to make sure you get your application in. Late applications are not going to be accepted. We anticipate that we are going to have way more than $1 million in applications, and it wouldn't be fair to accept a late application over others. Again, the link where you can submit it electronically. If you have any problems with the electronic application, you can call the grants hotline, reach out to any one of us. We were getting frantic calls at the end of the last round, managed to take care of it, but I would recommend going into the online application early, kind of feel around, make sure you can figure it out. And then again, our website, we have an email address, grants@polb.com. We have a hotline, 1-888-789-GRANT. Laura's the one who checks that email address and picks up that hotline, and she can answer your questions. Okay, I'm going to ask a question on behalf of the current grant recipients, because this has already come up a little bit. So if you've received a grant in the past from the port during the first round, again, these grants are intended to enhance or expand your existing services. You can apply for a grant to extend services or enhance things that you're already providing, but you cannot apply for a new grant to pay for services that you should be providing under your current scope of work. You can apply for as much money as you want. You will only receive $250,000, and that's $250,000 in any combination. So if you are a partner on another grant where you're going to get $50,000, and then you wanted to submit one for $250,000, you're going to have to make a choice there, because that's going to put you over that limit. And depending on where the rankings fall out, you may need to make some choices. So there's definitely going to be some calculating that you're going to have to do. Every project is evaluated independently. So if you submit more than one project, you're competing projects against each other. So that's something just for you to keep in mind. Again, we strongly encourage you, if you've got any questions or if you just want a little bit of feedback about what you're thinking, come talk to us. We will make the time. We've got 6 weeks for the applications, which is not a long time. So we will work around your schedules and make sure that we get you the information and the assistance that you need. Thank you.